patient from yesterday, and he came in. I was hoping we'd have some change in his symptoms. And go ahead and first of all, yesterday you said your toe.
Yeah, my toe. It felt really weird. Like I couldn't really extend my great toe on the left. It's like there's a string on the back keeping me from extending it. After he did the maneuver, it felt great. It felt like normal again. So that was the big difference yesterday. The numbness that I have right there on my heel, right now is still about the same. But big thing too, this morning I went to the bathroom. Like yesterday I said, it was going in my left, whole leg was going numb. Today, just minimal tingling. So that was great.
I woke up early this morning and tossed and turned about, different things. But one of them I was thinking, where would this possibly be? And now if we think about this, he said when he sits, has strains for a bowel movement. We found hip adduction weak, which is right here on the left side. So that's right where his sigmoid colon goes into his rectum. So maybe there's a contact or a connection between his sigmoid colon and a position somewhere around the piriformis obturator internus. So I've been dying to get my hands on him because I've been thinking about this most of the night. So lie down on your left side. And I was hoping he was a little bit better so that we can...
Is this okay?
Yeah, you're fine.
Down on my left.
I'm trying to get... There we go.
You want my left?
Yes. Okay, straighten this leg. This leg right to here. This one is going to come right to here. When we do the movement, remember yesterday we did some movements like this, okay? But just relax for a second. Let me see if I can find anything. Well, this is like an onion. You start peeling off layers, and so they come in, and now something else that wasn't there yesterday. Quote, it was there, but you could, because you took some of the onion away, all of a sudden you see another one. Now, I don't know whether you can feel this, but when I go deep in here and go right there.
Where's your hand placement on the back?
The hand placement on the back is probably at the level of S3, okay? And the level doesn't mean anything. What I did is I took up all the tissue tension three-dimensionally I could right here, and then I take this hand and I just go back and palpate, and I feel when I push back here, do I get a pull on the front? Okay, so this is what we're going to go over later on in the day. But so I palpated around here, and there's where, if I touch right there, can you feel when I do that compared to right here? Mm-hmm. I said, now all I want you to do is keep your foot on the table and lift your leg up to the tightness. Don't go past it. You're going right there. And oscillate fast. Ah, no boy. There we go. Okay, now remember what we did. Come up a little higher, little higher, little higher. Keep going, keep going, keep going. That's it. Good. Now let's cheat a little. Okay, relax. Okay, now you're gonna pull your knee. Remember how your knee came up towards your chest and over the back of the bed, then over. Okay, remember? Okay, up and out, up, out to over the bed. That's it.
Alan, is your right hand placed over the
medial
lower quadrant?
Right. Mm-hmm. Okay, stop, and then go back to the original position. Okay, that feels pretty good, so we're going to let you go for now. So just treating the one, thank you, just treating the one area, the primary area here, we got some relief of symptoms. But if you think anatomically, he says he had numbness and tingling down, so he's affecting the sciatic nerve somehow. And so how can you possibly be affecting the sciatic nerve from right here? Well, you can't directly be doing that, but if there's a tightness from front to back, that when he does this and strains and pulls, and it pulls back here, it could put pressure on the sciatic nerve and cause numbness and tingling. So you not only have to know technique, you got to know your anatomy cold. So you got to go back and review and get your netters out and follow the nerves. And okay.
Why did you mobilize that at S3?
I locked the front three-dimensionally, and I touched it at a level of 1, 2, 3, 4, and I kept moving around to see when I pushed in here what level pulled my hand in. So that tells me that there's a connection front to back. And so then I locked the front, and I locked the back, and I asked him to start oscillating. And as it releases, he goes further and further and further and further, and then up and down and up and down and up and down. No, it wasn't over. I said it was the level of L3. It was in the musculature, probably at the piriformis or obturator internus level. Okay, Carol, how are you doing?
I'm doing better. I could walk on the beach last night and it didn't bother me normally. It'll irritate that right side and I did really well. I got up this morning and thought, okay, I'll test you out. So I did all my active range of motion and it didn't hurt. So
Good.
great.
So we have 3. Okay. Any questions?